Hello and welcome to my channel everybody. So today we are going to see about irritable bowel syndrome. So let us begin with an introduction that what is IBS or so called as the irritable bowel syndrome. So it is not a disease but it is a kind of functional disorder which simply means that the bowels are not working properly or it is not working as it should. So it is a common disorder which is affecting large intestine, particularly the colon. Commonly, it causes cramping, causes abdominal pain, bloating, gas, diarrhea, and constipation. So these are the common symptoms that it causes. Next, moving towards the another thing, that is what about the epidemiology. So as according to the available data, 22% of the population worldwide gets affected with IBS, and it is the commonest reason, like 20 to 50% of the gastroenterologist visit is due to IBS. Also among children, there is 26% of the children have complained with recurrent abdominal pain. If we see age wise, before the age of 35, the prevalence rate is about 40%. Between the age group, like say 35 to 50, the prevalence is about 50%. And the affection, male female ratio, females are more affected as compared to male, and that is in the ratio of 3 is to 1. So this is about the epidemiology. Next is, what does the colon do? That is in case of IBS. Just a second. So what happens here, that the contractions of the colon muscles and the movement of its content, it is controlled by nerves, hormones, and the impulses in the colon muscles. This contraction in the normal physiological pattern, it moves the content inside the colon, and that is towards the rectum. During this passage, water and nutrients are absorbed and the leftover is eliminated as waste. Now, a few times each day, contractions push the waste down the colon, and that results in bowel movement. But if we see in case of IBS, that what happens here, that here in case of IBS, the muscles do not contract in the right way. So this is what it doesn't contract in the right way, and so the content do not move correctly, and that results in symptoms like abdominal pain, cramps, constipation, a sense of incomplete stool movement, and diarrhea. Right? So it is just the representation of saying like the bowels getting irritated and presenting the symptoms. So this is the picture showing the normal colon. You can clearly visibly see the difference, and this is the spasticity seen in the case of IBS, also called as the spastic colon. Okay, moving further about the causes. So causes is the first cause, that is abnormality in the GI tract movement. Second is change in the nervous system communication, that is between the gut and brain. Third point being sensory and the motor disturbances of colon. Common factor seen, that is dietary allergies or food sensitivities. And the fifth point being neurotransmitter imbalance. Neurotransmitter imbalance, and that is commonly there is decrease in the serotonin levels. The last factor being stress. Now moving towards the pathophysiology. Okay, so now moving towards pathophysiology. Yeah, this is the right thing. Okay, so IBS pathophysiology, it is not clear, but there are certain theories that are put forward, but the exact mechanism is still that uncertain, but we can go with it. That is the first thing being the alteration in the GI tract motility, because there is changes in the frequency and irregularity of the luminal contraction. It causes irritation of the colonic muscles and causes symptoms. Second is visceral hypersensitivity, because of increased responsiveness to stimuli, defect in the brain gut axis, that is the communication mishap between the enteric nervous system and the central nervous system. Post infections, about 10% of the IBS cases that is triggered by acute gastroenteritis infections. And genetics. Genetics also plays a role and can cause the pathophysiology, that is the symptom presentation case of IBS. Let's see now who are those people who are more prone to get IBS. So usually those people who are suffering with panic disorder, persons who are having any other psychological disorder, because we always know that brain, gut and mind, everything is related, right? So person with panic disorder or the psychological conditions are more prone to get IBS. Also, if there is family history of IBS, similarly as so-called the association of genetics with it, so family history, and the people with other conditions like chronic fatigue syndrome, fibromyalgia, and the temporomandibular joint disorders. Okay, so fibromyalgia, as we know, that it is a condition which causes widespread muscle and soft tissue pain and tenderness, and temporomandibular disorder that causes pain and discomfort in the jaw muscles and joint. Okay, symptoms: patient will have the symptoms of pain, distension, abdominal discomfort, and bloating. Next is the patient will be having abnormal bowel habits, and they will have alternate periods of constipation and or diarrhea. Sensation of incomplete bowel movement, and mucus in stool. Let's see about the types of IBS. Okay, so there are three basic types. One is constipation predominant, second that is diarrhea predominant, and the third one is alternate constipation and diarrhea. So constipation predominant, if we talk of about, here the patient tends to have alternate constipation with normal stools, and the symptoms would be of abdominal cramping or aching, which are commonly triggered by eating. Clear? Second is the type that is diarrhea predominant, where the patient would tend to experience diarrhea either that is first thing in the morning or after eating, and alternate constipation or diarrhea, which is also called as the mixed IBS. Next point about the diagnosis of IBS, and that is commonly diagnosed with the criteria so called as the Rooms criteria. Now Rooms criteria, what it says that according to this criteria, if the patient is having certain signs and symptoms before having the the diagnosis of IBS. So there's abdominal pain and discomfort which lasts for about 12 weeks, and these weeks don't have to be consecutive. At least two of these symptoms should be present, that is change in the frequency or consistency of stool, straining, urgency or feeling that the patient cannot empty the bowels completely, mucus in stool, and bloating or abdominal distension. So this is about Rooms criteria as a test or a criteria for diagnosis of IBS. There are certain additional tests also that can be done or should be done, and so as the case. The first is flexible sigmoidoscopy. Here what is done, that it examines the lower part of the colon, and that is with a flexible lighted tube. CT scan as the second test, which produces the cross-sectional X-ray images of internal organs. Colonoscopy, it is where the small flexible tube is inserted, and that is to examine the entire length of colon and to differentiate it from the lactose intolerance patient. A test called as lactose intolerance test needs to be performed, because there is very much resemblance in the symptom presentation of IBS and the patient with lactose intolerance. So this is the thing that should be done. So what is the principle behind this test? That there is an enzyme called as lactase. Now this is an enzyme which is required to digest the sugar which is present in the dairy products. Now, if this enzyme is not produced, then there will be problems like abdominal pain, there will be gas, there will be constipation, diarrhea. Okay. Now, to find the cause of the symptoms, there is a test called as the breath test, or asking the patient to exclude milk or milk products from the diet for several weeks and see for the symptoms. Okay, so hydrogen breath test, if I say what it is, just in a very quick brief, it is simply a oral challenge where lactase is given like 20 to 50 grams, and after 2 hours a follow-up is done for the detection of hydrogen plus the occurrence of the symptoms. But easy ways also to ask the patient to exclude the dairy products for about week and see for the symptoms. Last portion for this video, that is the treatment part of IBS. So treatment, it involves three things. It has to be a mix of drug, it has to be diet, and also psychological intervention. So you can say that the treatment in it is a mix of these three things. If we talk of about the drugs part, there is antispasmodics, tricyclic antidepressants, SSRI, selective serotonin reuptake inhibitors, probiotics, laxatives, antibiotics, antimotility agents, and serotonin antagonist. If we see about the diet, the patient is asked to avoid all the triggering food items. That is, usually these are lentils, legumes, and beans. Low FODMAP. This is also to be advised. It is usually fermentable oligodimonosaccharide and polyols. Now these are short chain carbohydrates which are very poorly absorbed in small intestine. So all these food items are to be avoided, and the patient is said to have fiber supplementation. Yeah, so this is all about irritable bowel syndrome. I have tried to make it in a beautiful way and hope it is useful to you. And thank you so much for watching my entire video. And one more thing, I have added a short regarding the mnemonic of IBS in the same channel. So do go watch it out. Thank you so much for watching, and yeah, stay tuned for more.